futuristic topics where all the pharmacies will have a lot of placement services and all. You can also make a career. Okay, so it's a very important topic, and this is upcoming. So I hope all of you should hear very carefully, and please note down if you have anything, any queries. So at the end of the session, we'll have the queries. Okay, we can have a small question answer session, maybe 3 or 4 questions, not more than that. Okay, because followed with one more session is there. Thank you. Sir, Dr. Amish sir, welcome to Danteswari College of Pharmacy, sir. On behalf
Thank
of
you.
student, staff, and management, I heartily welcome you to this show. Thank you, sir. Thank you for joining. Again, I am sorry that you are supposed to be present here on physically. So it would have been honored for us, but again, will because of some unavoidable circumstances, so we are unable to do that. So next time we will plan and we will invite you to our session, sir. Thank you
Okay.
very much. I would like to read the small biography of Dr. Amit sir for our student and staff. Dr. Amit Agrawal sir is presently with postgraduate PMG PGIMER Chandigarh, which is one of the most prestigious institution of India. And sir is the project leader and consultant in Regional Research Center, Department of Telemedicine and Postgraduate Institute of Medical Education and Research at Chandigarh, India. He did his masters in biotechnology from University of Rajasthan, Jaipur, and doctorate in PGIMR only. The topic was the role of T regulatory cells in asthma, especially in children's, from Postgraduate Institute of Medical Education and Research, Chandigarh, India. And he has worked as a scientist, C, in ICMR, Advanced Center for Evidence-Based Child Health, and also involved in many systematic reviews related to the emerging field of medicines. He has joined the Department of Telemedicine in 2016 and in 2021 as assistant professor. He also involved in the M Health project funded by Bhabha Atomic Research Center in validating the tele-ECG device developed by BRNS Mumbai. He has 90 research publications to his credit in the field in peer-reviewed medical journals and chapters in the books. He is life member of different international agencies. He is also registered stakeholder at NICE, National Institute for Health and Care Excellence in UK, for asthma quality standard update and cystic fibrosis quality standard. He has awarded many international and national awards. He is a knowledge partner for EUPHC's 100 ambulance services and 102 services assessment with Department of Health and Family Welfare, Andhra Pradesh. He is involved in different policies making with MOHFW, Government of India, especially in developing National Digital Health Mission blueprint. He is member of COEAI, Center of Excellence for Artificial Intelligence in Healthcare, a committee of PGI MER Chandigarh. This is all about Dr. Amit sir. Once again, welcome to Danteswari College of Pharmacy's National Seminar. Sir, over to you, sir.
So I think my voice is clear.
Yes, sir, it's crystal clear,
Okay.
sir.
Okay. So today is my topic on, and thank you for the brief description. So my talk is on telemedicine, the way forward to digital health. Actually, I will be talking e-pharmacy in between, but I just want to tell you the journey of the telemedicine in PGIMER, the facility, what we have provided here, and how a pharmacist can involve in this facility.
Sir.
So, as our dedicated, this presentation is dedicated to our honorable Prime Minister because he is only has the vision that one cannot make available thousands of medical specialists to the remote areas, but one can make their services available through digitally at multi-service centers at every village. So he initiated the Digital India. He initiated the National Digital Health Mission, and Ayushman Bharat Digital Mission. So our center in the lines of PM Modi, our department is also in the phase that we have regional resource center of designated by the Ministry of Health, the Center of Excellence for Artificial Intelligence. As you all know, that artificial intelligence is very important today, and many projects and many things are running in artificial intelligence. So we have the Center of Excellence for AI. We have the unique center for the Center of Excellence for Telepathology, because you know that there are lot of pathological images lying in peripheral, but there is no any reporting officer there. So we have the Center of Excellence for Telepathology. We have the E-Vidya Bharati Arogya Bharati program with the Ministry of External Affairs, and we have the tertiary care hub with the National Health Mission Haryana. So as we all know that the PGI Chandigarh is a national importance institute, and highly specialized, and providing the services basically to the north region of India, like Chandigarh, Haryana, Himachal Pradesh, Jammu Kashmir, and parts of Uttar Pradesh, Uttaranchal, Rajasthan, and Leh Ladakh also. So the journey of the telemedicine started in 1998 for 2012, 13, 21, because there are uh, lot of things happened before COVID. Actually, the COVID is booms the telemedicine. So, but we have already settled department here before COVID also. So you can see that 1998 the beginning is there. Then the National Medical College Network, the Government of India launched 2012. Regional Resource Center we have the 2013, and after the COVID, we have three major our things like ABSWC, Center of Excellence for AI, and Center of Excellence for Telepathology. So this is a picture where then Prime Minister Manmohan Singh inaugurated our Department of Telemedicine, and it was started in 2005 in the Baisakhi Day, and we have provided 25,000 consultations till January 2021, which includes e-Sanjeevani software. I will tell you after some slides that what is e-Sanjeevani and Sanjeevani software. So this is only the inauguration part that we have done in 2005, and how we are connected initially with the Punjab only, the Chandigarh and all the districts of the Punjab. Then in 2015, the Regional Resource Center comes. So Regional Resource Center basically is developed by the Ministry of Health and Family Welfare, Government of India. In 2015, they have established an e-health section there, and all the digital health related things was managed by the e-health section. So how we are connected with different medical colleges in North India, because there are many regional resource centers, 8 regional resource center all over India, and we are one of them. So we are looking only the north part. So all the government medical colleges situated in the north part, Jammu Kashmir, Punjab, Chandigarh, Haryana, Ladakh, and Himachal Pradesh, or which are to be government hospitals and colleges which will establish in future, they all are under our periphery. So sorry. So we have the inauguration of the telemedicine nodes. Actually, in the telemedicine, we have provided the services through VSAT, the satellite services from ISRO. We have provided the NKN National Knowledge Network, the high bandwidth network there. So the distant area, like where the mobile services are not there, where the internet services are not there, the satellite services are working. So in telemedicine, we have the connectivity of satellite services, and we have dedicatedly providing the consultation during the Sheshnag, during the Amarnath Yatra, during the Ayappa Temple, Sabrimala Yatra, and in the Puh, which is very remote in the Himachal Pradesh. And these nodes are established by the Government of India and inaugurated by the Union Health Minister. So we have provided community outreach services. I just want to tell you one thing, that during my talk, you can also phase out what is your scope of area as a pharmacist. How can you interpret in these, so that that's why I am I make the slides from beginning, how the telemedicine grow up in telemedicine in PGI Chandigarh. So you can grab how you can fit in the telemedicine in the e-pharmacy. After that, after some slide, I will let you know that how you can involve, but you can also find out some possibilities if there. So we have developed
Mga,
tele ECG with the
sabi
Bhabha
senda
Atomic
se
Research
do din
Center,
ta ko ini
Mumbai,
asagta. Oh
and
my god.
this is how we are
Roshan.
delivering the health through cell phone. So we are providing, basically the telemedicine is constituted in like tele-education, teleconsultation, and tele-evidence, the artificial intelligence, the telepathology, teledermatology. There are many things are there, but the most focused area which we are doing is tele-education. So we are providing different type of tele-education activities related to like how we are courses we are developing, content developing, the online courses we are running. So this is the whole area, that how the telemedicine doing in the PGI. Like we are providing the clinical pathological conference, the workshops, the PhD vivas, webinars, everything we are providing here, and it saves lot of money for the PGI. So these are the some shots, some things, that we are managing the hepatitis C in the district hospital of the Punjab. We are providing different type of activity, education activities from here. The most important thing that I would just want to tell you, that we are developing the online module for the undergraduates in the learning management information system. So here we are doing that with the Ministry of Health. We are developing the undergraduate courses for the MBBS people who are doing the MBBS. But in future, we also develop the pharmacy courses in online services. So in this LMIS module, so you can just as you are all enrolled in a pharmacy college, you have your registration ID or you have your enrollment number. You just put the enrollment number there, and you can see all the online courses available by the government of India. But it will launch soon. It is not yet completed. It is the screenshots which I am providing. But the after the medical courses development, we will develop the pharmacy courses in this area. So your involvement is very much needed in this LMIS module. So these are the screenshots how we are developing different medical fields, different medical topics, that basically most importantly, that the high impact people are doing this. They are all basically are the assistant professor and the professors of the PGI Chandigarh and nearby colleges. They are all are very well recognized people who are developing this type of courses. So in the news also covered that we already developed the 20 modules for the free online courses, and all over India, total 200 modules has been developed so far. So in the research, we are developing different kind of innovations with the industrial partner, because we can only give the idea. We can't make machines, or we can't make any equipment. So we have to partner with some third party, some industrial partner who can develop our uh, who can phase our idea into a machine who can develop that. So in the form, we have developed the tele ECG, tele spirometry, and you can talk that it is M health technology, because all the things, all the graphs or ECG or the spirometry graph, they come to the your mobile phone, and you can transfer it to the doctor without any hassle. So how we have presented this facility, this innovation in the Rashtrapati Bhavan, and this entry has been selected. And we are also developing the mobile computer based clinical rounds, because PGI is very much crowdy, and almost 11,000 OPD we are doing daily. So every patient needs to be know that where he should go for the visit to the doctor. So in the Google Map or in the GPS system, PGI is located, but not the department which where the patient should go. So we are developing the inter-department mobile computer-based clinical rounds, the mobile computer GPRS enabled wheelchairs, GPRS enabled stretchers, and other things. So you can see this is a demo that how any patient having a tab, how can she or he can reach to the destination. So why I am talking about all the innovation, that you also doing some kind of innovation in the telemedicine field in related to the pharmacy field, that you can develop anything whatever you want, because you are in undergraduate or postgraduate courses you are doing. So if you think about something related to telemedicine, related to something like a digital thing, because now you all have your mobile phones, you all are very tech savvy, and you all have any everything in your hands, and you can do anything. So you can share your idea with us, and we can develop it in from our hand. And of course it will beneficial to you in your future. So how the ministry is involving, that we are showcasing our international trade fair in Delhi. So we also developed nearby kiosk of the e-health, that near rural areas we are developing. The foreign delegations visit Delhi in PGI, and there are a lot of things that Maldives, Philippines, southeast countries are visiting telemedicine. Now the most important thing that you have to listen, that the features of the telemedicine. So here your roles comes, that in India digital health policy is there, but actually in 2020, when the COVID come, the Department of Telemedicine, the Ministry of Health and Family Welfare, the Ministry of External Affairs, they all come up and they launched the telemedicine practice guidelines in 25th March 2020. So actually, before COVID, there is no certain guidelines how to do telemedicine, how to provide the teleconsultation services. So after that, the doctors and the hospitals come up with a new shape, and they are providing teleconsultation services in a structured way. So it is very important to discuss that how the telemedicine services can be classified, and they are mostly provided into the four forms: the according to the mode of communication, according to the timing of information transmitted, according to person involved, and according to purpose of consultation. Actually these 10 slides are very important of my topic, because it is all related to your pharmacy field. Because every consultation generated a prescription, and there the medicine has been written, and you have to be very concerned about that, how, and if the medicine is written there, it is it according to the telemedicine practice guidelines. If there is no not, so how you can come up with the medical legal issues or something. So here the e-pharmacy roles comes, that whenever telemedicine or teleconsultation is providing, you have to be very particular what type of consultation is being there, and how the consultation is managed, and how and what type of medicine has been prescribed. So the four type of telemedicine consultation are there: the mode of communication, the according to the timing of information transmitted, according to the person involved, and according to the purpose of consultation. So what mode? According to the telemedicine guidelines, the teleconsultation can be carried out by any phase, by landline phone, by video calling, or on the WhatsApp, Facebook Messenger, any device connected with LAN, WAN, internet, any mobile landline phones, any mobile app. So there is no any barrier, that according to the communication they can do any type of, they can choose any type of media, and they and initiated the call. It is the mode of communication. It is related to mostly patient to doctor consultations. So if I discuss like according to the timings, so two type of information can be transmitted: real time or store and forward. So what is the difference between two? The real time is like the patient is sitting and physician can initiate the call. Okay, and the other end, their doctor is available, so they can do the consultation in that time only. No any no any disturbance or something, like live you can say. So real time is like live teleconsultation. Store and forward is like that you can send an email to for any like or WhatsApp, you can do any doctor that these are the reports, please see. And after some time or after 1 day or 2 day, the doctor see that email or the images, and prescribe that this kind of it is this diagnosis, and you can provide this, you can take this kind of medicine. So this is the difference between the real time and store and forward. So nowadays real time is most popular compared to the store and forward. Then according to the person involved, so there are four type of consultation can be happen. Patient to the registered medical practitioner, that is like patient have the number of the registered medical practitioner, and he just called that sir, I have a fever, and please prescribe me some medicine or something. The caregiver to RMP, like patient is not in a phase to call, or he is not tech savvy, or he is a child that he needs a caregiver for teleconsultation, so that caregiver may contact to the RMP. Third is the RMP to RMP that we are doing, that registered medical practitioner is in some dilemma in the diagnosis. He already has the patient with him, but he doesn't know how to treat the patient. So he for the you can say some advice, he initiated the call to the tertiary care hospital. So this is to RMP to RMP, and the healthcare worker to RMP, like where the registered medical practitioner is not there, the pharmacy people, the you can say nursing people are there. They are not actually doctors, but they are health workers. So they can initiate the call to some RMP if after they examine the patient, and they can share their findings to RMP. Next, according to the purpose of consultation, suppose the patient is coming first consult. First consult means RMP doesn't know about any patient. He is very new to that patient, and patient uh, consult to the RMP the first time. So they can consult to the RMP. So it is like it is called first consult. But the RMP already seen the patient, already they have the notes or the card with him, and again the patient is come up like the same disease, that sir, you have treated me for this disease, and now I am now there is the follow up consult. So two type of consultation is there: first consult and the follow up consult. Now the most important thing, that medicine, how the medicine prescription in the telemedicine. So you have to be, because you all are belong to the pharmacy and you are doing that, so you have to be very clear that which kind of medicine has been prescribed in the teleconsultation. So in the telemedicine practice guidelines, there are four category uh, have been made, and you have to be very particular about this list, and you have to be like remember in your mind that which list has which medicine. So list O, list A, list B, and prohibited list. It is very simple that list O means like over the counter. The list every medicine, any medicine which is available without any prescription. To suppose I just want to buy paracetamol, I can go to the pharmacy and I can say that please give me one strip of pharmacy. So there is no any it is available in the counter. Second is the list A. List A, it is very restricted because it only prescribed when the first time consultation has been happened, and you have just refill that refill that drug. Okay, list A means that only already one prescription already been done first time, and first visit is your physical visit, and you just refill your medicine. So it is list A. List B is that list B also is the same, but list A is the refilling and list B is available on the follow-up consult. What is the difference between list A and list B? If you are confused, list A, the first visit is physical. List B, the first visit can be on the video call, on telemedicine. So there is a difference. The prohibited list is list X. They can't be prescribed through telemedicine platform. Narcotic drugs, psychotropic drugs, they are banned to be prescribed over telemedicine. So this is a comparison that in the list O, any mode of consultation, any mode of nature, you can prescribe. List A, video consult should be there first, and first consultation, follow-up consultation, refill consultation you can do. In the B, any type of consultation, but only the follow-up consultation you can prescribe, and prohibited not to be prescribed at any phase. So some important features of telemedicine practice guidelines, that it is effective very much, and uh, it covers the standards of the RMP. All the channels has been you can use during this consultation: audio, video, text, digital. Emergency case, you can't be in the emergency case if you are not providing any type of consultation, or you are not in the phase to provide the consultation, you can discuss with the RMP. One second. Submitting. TM consultation is should not be anonymous. Both patient and the RMP need to know and verify each other identity. So you can't prescribe anything without knowing the patient, and patient can't be asked to any kind of any RMP that. So they have to be known to each other. Like suppose I am providing the consultation, so I can say I am Dr. Amit, and I am a pediatrician, and I, so like you can involve in that way. So before any consultation, you have to take the consent, patient consent. So there are two type of consent: the explicit consent and implied consent. So in the explicit consent, you can the healthcare worker, the RMP, or the caregiver. They are they. Sir, excuse me 1 minute. Important. हेलो हेलो सर, अनिल सर, मैं आपसे मैं ठीक हूँ सर, आइए अनिल सर, मैं 1.5 सर करवा दो, ठीक है। हाँ जी हाँ जी हाँ जी बिल्कुल सर, ठीक है, डन सर, ठीक है। Sorry for the break. Actually, there is a call from the ministry, so I have to take. Uh, so is it okay for all of you that this presentation, sir?
Yes, sir.
Okay, thank you. Uh, So, as I already told you that the telemedicine can be applied in the various services: teleconsultation, teleeducation, telepathology, teleradiology, telemonitoring, telesurveillance, telesurgery. Everything can be managed by the telemedicine now. So, so what is the role of e-pharmacy? What is the role of pharmacy in this field? Can anyone can say anything, like how you fit? How can you supposed to be fit in the telemedicine? Any idea from anybody, any student?
Yes, sir. In telemedicine, in fact, I had come across with report. I have come across with one company. It is named Meditel,
Yes.
and Dr. Lalit Manik is the chairperson of that company. He is a medico, and
Okay.
it is a startup company started in Odisha.
Okay.
Since I think around 7 8 years back they have started, and
Mm-hmm.
they used this platform of telemedicine.
Mm-hmm.
What they did is they have a program, and they have given distributed one tab, and they
Mm.
have opened around 35 to 37 counters in the interior part of Odisha, and
Yes.
they have hired pharmacists.
Yes.
Suppose
So.
suppose at Jagdalpur, I am the pharmacist. I have joined hand with them. They have
Mm.
provided with me a tab. I have
Mm-hmm.
opened a small clinic having the
Mm.
minimum infrastructure, like whenever the patient comes, height, weight, BP,
Yes.
pulse, and
Yes.
all. I will
Yes.
check, and on the tab, I will feed up give the details, and
Yes.
along with that, I'll give the I mean the kind of what are the problems, symptoms I used to write. Then immediately they were having a pool of doctors. Whatever symptoms I will feed according to the symptom, immediately a doctor will join. They were having a call center. They
Yes.
will connect with a doctor, whoever is available, wherever he is sitting. So they used to doctor immediately used to come online on a video call. He used to see the patient and the symptoms, and immediately the medicine used to be generated. He used to generate a prescription. Even they were so beautifully they were working. They were having diagnostic as well as pathological devices are also attached to it. Even immediately we could use to do the ECG, even eye testing
Yes.
where we used to do, even the pathology, the minimum
Yes.
thing,
Yes. Yes.
CBC and all reports we used to take, and immediately ECG report also we used to get. So it
So,
was a
sir, actually,
fantastic
yeah,
thing.
yeah, it is
And
very right.
everywhere pharmacist used to
Yes.
maintain the
Yes.
interior part of it.
So as sir said that every field, every in every step of telemedicine, we can use the pharmacist. So
Sir,
actually, in my some part of my PPT, because it is not yet completed, is it will be there. So most of my part, you can see that we have running a hub and we have the pharmacist. So in the continuation of my PPT, let's see what happened next. So in the what are the forces which who driving the telemedicine? You can see the patients, because बिना patient के कुछ नहीं हो सकता. The patient is the main one. So patient is like demand for easy and convenient access for healthcare. No one want to go to the hospital for hassle and all. And if any facility is provided by sitting, the patient is sitting at the home and you are providing the service, it is very best. So the telemedicine is doing that. The physician and pharmacist are very important because the shortage of the healthcare staff there, and we have to approach the increase the efficiency. So physician are very important. And now, as in the foreign countries, every prescription has to be signed or has to be approved by the pharmacist. So in the telemedicine, it is come up. The technology is very important for the market growth. The government is very demanding in the telemedicine, and the telemedicine is decreasing their cost. The other regulated agencies or market competitors, large population, everything is like they are they are driving force of the telemedicine. So, how the government come up in the telemedicine? The telemedicine basically in the teleconsultation. So, teleconsultation is provided by the eSanjeevani, that is our national digital platform. So, this is a government service. It is not any private service. It is free of cost. Okay. So, this is developed by the CDEC Mohali, and it is in the combined efforts by the Ministry of Health and Family Welfare, Ministry of Electronics and Information Technology, Ministry of Ayush, Ministry of Rural Health Services, National Health Authority, PMJY, and Ministry of Labor and Empowerment. They all come up and develop the eSanjeevani. So eSanjeevani launched in 2019, the live version, and the first state which launched the service is Andhra Pradesh. And eSanjeevani OPD is launched in April 2022 because of the COVID. So there are two forms of eSanjeevani. One is eSanjeevani OPD, where the patient can call to any doctor, and eSanjeevani ABHWC, where the healthcare provider is called can only write to call to the doctor or doctor to doctor consultation. You can say. So after the eSanjeevani, the the national telemedicine platform, it is to be like game changer, and it saves the time and cost of the government and the patient. Everyone is like very much in the eSanjeevani now. Approximately 10 crore consultation has been provided by this application. So this is the dashboard of eSanjeevani, and this is very important for you because it is like a how the prescription has been generated. So you can see that we have the hub of PGIMER Chandigarh for the Haryana, and the patient name is can't be we can disclose, and you can see the prescription has been done by the ophthalmologist, and here his name is there. So is this prescription, is this medicine is according to the telemedicine guidelines? It is the important part of the pharmacist. So you can think like 10 crore consultation if it's been provided, to how many consultation is provided by the day, and how many pharmacist is being used or is being required by the government. So short overview, I just want to tell you how our hub is working. So our hub of the department in the NHM and Chandigarh, NHM Haryana and Chandigarh, it started in 2021, and we have all the specialists related to the major fields: obstetric, gynae, pediatrician, ophthalmologist, internal medicine, general surgery, and ENT. And you can see we have pharmacist also. So pharmacy is very important in this. That's why I just want to show you this slide. So how we come up, like in the March, we are from 500 and now we are reached at like 6,500 is like only for the internal medicine. And now the internal medicine is like triple time, like three times consultation we are providing. So we are providing 10,000 consultation to the Haryana nowadays per month. So total consultation till 31st August, we have provided 1 lakh consultations. And these are the bifurcation. You can see the obs and gynae, the internal medicine, the ophthalmology, the rhinolaryngology, the pediatrics, and the dermatology. So we have calculated that average consultation per day per consult is 50, and the time is 7 to 12. And you can see that 444 kilometers saved by every patient for the specialist consultation. Not only the kilometers, how much time he saved, because in PGI if any patient come, they it will take like 3 days to visit, because they have to stand a very long queue for making a card, then very long queue for any appointment with the consultants, and if any test is there, they have to come again to the next day, and for the report collection they have to come again on the next day. So it's like a 3-day procedure, and how much time he saved. And 972 rupees per patient government is saving. So the cost of per consultation for the government currently, according to our project, is 230 rupees only, and 7 to 2 point kilometers less for just for consultation, not a specialist consultation. They are saving 444 kilometer. And we done the study related to community health officers and the patient. So patient satisfaction is more important for us. So more than 96% patient has been satisfied with this service, and more than 67% has recommendation that this service can be continued. And there are some hubs also there in the Haryana, but 50% consultations only PGI has been provided. So we are also provided the sessions to training of the CHOs, the patients. So these are the screenshots of that. Or this is the picture, the how the happy family after feeling they are feeling very happy after getting the teleconsultation. So you can see in the news also, it is Haryana ties up with PGI is bringing down the mortality rates. and the ministry, the Union Health Minister Mavandia, Dr. Mansukh Mavandia also praises our uh, our service in the parliament 3 times in the Lok Sabha, Rajya Sabha, and the last year and this year also. So how this hub has been established, and this is our team. So next, I just want to brief you the Center of Excellence for AI, Artificial Intelligence. So in the quick way, I just want to tell you that only 3 center has been made the COAI, the AIMS Delhi, AIMS Rishikesh, and the PGI Chandigarh. And we have developed already. We have developed one machine learning approach for the prediction of asthma in children, and one app, and 4 proposals are running in this phase. One is related to cancer, lung cancer. One is for the alcoholic hepatitis patient. One is for the oral health cancer, and one is for PTH, primary hyperparathyroidism. So this is our director, Professor Vivek Lal, and he praises that PGI department is a center of excellence for telepathology now, and we are providing the rapid diagnosis, expert opinion, the real time teleconsultation, and everything. Whatever we can do, we will provide to the community. These are some of the publications that we are recently we have published through this department, and you can see teleophthalmology, tele-rheumatology, the remote monitoring of COVID patients, and the BCG vaccine against COVID. So many, and Lancet is there. So we have published Lancet paper also. So these are this is overall our telemedicine and your e-pharmacy or everything like telemedicine. In the brief, there is lot of things to be show you, but because of time consent I can't. But this is overall, I just say that telemedicine is doing because of the digital India. This is a digital platform, and because of the ABDM Ayushman Bharat digital mission, this is all under this umbrella. So we are looking more from the government support, and we have provided more for the community approach. So this is our team on the telemedicine, the doctors and our head and our professors are there. So thank you all of you for this opportunity to for talking to you about this telemedicine and related to some field in the e-pharmacy. Thank you, sir.
Thank you, sir. Thank you. Should we go for a small question
Yes,
answer
yes,
session,
sir.
sir?
Yes, sir.
Yeah.
Because question
Anybody?
answer is very important. That's why
Yes, sir.
I finished in like 40 minutes. I finished my talk so that you can take up like 5 to 10 minutes for the question answer sessions.
Sir, I have a
Yeah.
question, sir.
Yeah.
Sir, myself is Amrit Kumar Rath, sir, associate professor. Sir, basically we are pharmacy graduates, and we know the role, sir. We cannot prescribe the medicine. Doctors
Yeah,
are
you
there
can't.
for prescribe
Yes.
the medicine.
Yes, you
But
can't.
what happens, sir? There are certain OTC counters, over-the-counter sell medicines that we can give to patients. Is there any facility in telemedicine for the opportunity for pharmacists that they can prescribe the day-to-day life OTC drugs?
No, there is because in the telemedicine practice guidelines, you can't prescribe any type of drug, but you can manage the according to the list. You can manage which medicine can be prescribed by the telemedicine. You can check that also. So the pharmacist role is there after the prescription generated, and before the patient take the medicine. Their pharmacy role is comes. So, what the government is doing, they are hiring the pharmacist in between that the doctor who prescribed the drug is according to the telemedicine practice guidelines or not. So, pharmacist has to be checked that this drug can be prescribed and this is not been there. Okay, so he is the check of between the doctor and patient. It will come up because nowadays we are hiring the pharmacist, but multiple hospitals and the telemedicine companies also hiring the pharmacists in near future.
Sir, actually, myself is belonging to Odisha, sir. But
Okay.
there is certain provision, I think, sir, pharmacist can dispense medicine, especially certain drugs are there that they can give to patients directly, sir.
Sir, actually, there are two ways. Okay, I am talking about the telemedicine perspective. I am not talking about the normal perspective. Okay,
Yes, sir.
because
Okay, sir.
my talk is related to telemedicine. So telemedicine, I have already told you that you can't prescribe telemedicine drugs. Through telemedicine, the pharmacist can't prescribe, but they can check the medicine. But
Yes, sir.
in a normal way, it is already in market that you can sell the drug, you can see the drug, you can everything you can do, you can dispense the drug, but it is not related to telemedicine.
Yes, sir. Right. Sir, another last question, sir.
Yes, yes.
Sir, can we open a center at our college premises by collaborating with the PGIM IMR Chandigarh, sir?
100%. Yes, yes, you can.
Okay, sir. Thank
Yeah,
you.
the
We'll love
initiative,
to do
the
that.
initiative, the initiative taken by you, and you can attach with our college, our PGI, and
Sir.
but you have to be taken care that what kind of facility you want, and what
Sir.
kind of things you can do with us.
Yes,
Not
sir.
really, and most importantly, it is patient perspective, because our
Yes.
aim is to be like patient,
Yes.
कम्युनिटी रीच. सो हमारा एम है पेशेंट का भला. पेशेंट का
Sir.
भला जहाँ होगा वहां पर वी कैन डू एनीथिंग.
Yes. Okay, sir. Thank you very much. This is a very nice session, sir. Too much
Actually,
informative.
I have made this because it is overview. I just want to tell you what is telemedicine, because none of you, I think, like Kiwi, what is doing in telemedicine. So how you can put in the pharmacy in the telemedicine? You can put
Yes,
pharmacy in everywhere if you want.
sir. Thank you very much, sir. Thank you, Shruti, sir.
So students, you can ask any question, because it is the talk is for you.
Yeah, true, sir. Anyone from student side?
Anything you, what you want to become, you can see your career in the telemedicine. You can just now you can start, because you are in the beginning phase. You can start with that. आप लोगों को अच्छा तो लगा टॉक या नहीं, ये तो बता दो. Yes, sir. Mahendra Kumar ji, yes. सर आवाज बहुत कम आ रही है.
You are not audible, sir. Dr. Panigra, you are not audible.
If students wants to consult, how can he contact with PJ Chandigarh for teleconsultation?
Sir, actually, for the teleconsultation, you can't contact to PTA directly, because you have to be talk to your government, the NHM of Chhattisgarh, that they establish a hub under the PGI. That's why it will happen. You can't directly contact to us for the teleconsultation.
If you want to set up what are the guidelines and to set up the new consultancy
So
center?
set up the guidelines for the setting up the hub here. You have to go to the NHM officials, the National Health Mission officials, and you have to talk to them, and then the meeting will be PGI Chandigarh and the National Health Mission Chhattisgarh, and after their meeting, their MOU has been signed, and then only the establishment can happen.
Thank you, sir, for your advice.
Yeah.
Anyone student?
Anybody from student side? Any student? Do you have any questions? इसका मतलब बच्चे कुछ भी नहीं समझे. There should be, it's a new topic, new area. You should ask as much as questions you have.
देखो जो ज्ञान है ना वो तभी बढ़ता है जब आप क्वेश्चन पूछोगे. यदि
Exactly.
क्वेश्चन नहीं पूछोगे तो वो ज्ञान कभी नहीं बढ़ेगा.
सर या तो आप सब कुछ समझ गए या तो कुछ
हाँ.
भी नहीं समझे. इसका मतलब यही है.
बिल्कुल,
और
बिल्कुल.
दूसरे वाले को ही हम सोचेंगे कि वही सही है. Anyway, sir, thank you very much, sir, for coming and addressing our students and all.
Thank you.
It would have been
It will
more
be-
interactive अगर
Yeah.
ये physical
Yes.
हो सका.
Yes.
तो sir will definitely plan it for in the month of December or January, especially for our students and staff.
Okay.
And thank you very much,
Yes.
sir. You have very elaborately explained how telemedicine has started, how it has groomed up, and now Government of India has come up with so many initiatives like RRC. They have set up this artificial intelligence, telepathology, Vidya Bharati, Arogya Yojana, ABHWC, and all. And in fact, we should read and explain our final year students extensively so that they should be aware, because lot of I can see lot of opportunities are
Yes.
going to come in future. In fact, till now this pharmacy course is mainly designed for industrial pharmacy. So till now, most of the student passing out from degree and post graduation, they used to go to industry. But I think now the time has come to
Yes.
enter into this telemedicine, community
Whole-
pharmacy,
yeah.
hospital pharmacy, and all. This sector is really growing, and we need to work on these aspects. And our students should know more and more, and they should get hands-on experience through seminars and conferences and all. So, sir, we'll definitely do it, sir. Thank you very much for explaining so extensively. But
Thank you.
I'm sorry once again कि ये physical होना चाहिए था, and we'll make it sure
Okay.
within a month or two we will
Yeah, yeah.
plan for this, sir, and also we will involve our pharmacists, those are who are into retail and community level, so that they can start some units at their own centers and all.
Thank you.
So thank you very much, sir. This is a small appreciation. This is certificate of appreciation. The
Thank you.
physical copy I will be sending it to you by post, sir.
Okay. Thank you.
Thank you
Thank
very
you.
much for
Thank you
coming,
for
sir.
inviting. Thank you for inviting. Thank you.
Thank you, sir.
Okay.
Thank you. Yeah, thank you, my dear students and staff. अच्छा हुआ सेशन अच्छा लगा. इट्स ए वेरी अपकमिंग स्ट्रीम. आपको इसमें इसके बारे में अच्छे से समझना बहुत जरूरी है. आपके लिए बहुत सारे अपॉर्चुनिटी अवेलेबल है सिटिंग एट योर होम टाउन. आपके गांव में, आपके शहर में बैठते हुए भी ये काम आप कर सकते हो, एंड यू कैन अर्न योर लाइवलीहुड, एंड यू कैन हैव ऑल काइंड ऑफ रेस्पेक्ट इन योर लोकल एरिया. इसके बारे में मैं अमरीश सर को कहूँगा, बिकॉज ये जो सिस्टम है जो मैंने बता रहा था सर को, जो मेडिकल कंपनी है और जो डॉक्टर ललित मानिक है स्टार्टेड, एक स्टार्टअप कंपनी है, उसमें अमृत रथ सर खुद काम किए हुए हैं. ही वॉज हैविंग 10 to 12 सेंटर्स इसी पैटर्न में एस्टेब्लिश किए थे. तो उसके बारे में मैं एक सेशन लेने कहूँगा, मे बी आफ्टर दिस NPW, एंड इट इज रियली वेरी अपकमिंग स्ट्रीम. आप सबको इसके बारे में काम करना और सोचना बहुत जरूरी है. ओके, थैंक यू वेरी मच. एंड एट राइट एट 3 o'clock बहुत डॉक्टर कलाई सलवन इज गोइंग टू एड्रेस. आप फार्माको विजिलेंस का गवर्नमेंट ऑफ इंडिया का हेड है वो. He is controlling entire all the states and union territories of India, and he was one of the pioneer man जो कि फार्माको विजिलेंस का शुरुआत इंडिया में किए थे. वो शुरुआत दिन से, पहले दिन से फार्माको विजिलेंस सेंटर में है, जो आपको कहते हैं PVPI, फार्माको विजिलेंस फार्माकोविजिलेंस सेंटर्स ऑफ इंडिया, जो कि हमारा गाजियाबाद में है. दिल्ली के पास जो गाजियाबाद है वहाँ पे है सेंटर. उसको इंडियन फार्माकोपियल कमीशन के अंडर में है वो. जो हमारे इंडियन फार्माकोपिया जो आप लाइब्रेरी में देख रहे हो, इंडियन फार्माकोपिया, ये सब इंडियन फार्माकोपियल कमीशन करते हैं. और उसी के जो फार्माकोविजिलेंस के हेड है डॉक्टर कलाई सलवन. ही इज गोइंग टू एड्रेस यू एट 3 o'clock. सो 3 बजे तक, अभी 10-15 मिनट है. सो आई वुड लाइक टू आस्क सम ऑफ योर फ्रेंड्स, सॉन्ग के लिए एंड डांस के लिए कुछ प्लान था. डांस के लिए तो नहीं हो पाएगा. इफ दे कैन हैव 1 or 2 songs विद इन 5 minutes, 1 or 2 songs. प्रवीण, कैन यू आस्क whoever is available? Okay, ठीक है, तो 10 मिनट के बाद हम लोग फिर से ज्वाइन करेंगे, मे बी 2:55 वी विल ज्वाइन, तब तक 1 या 2 गाना हो जाए। प्रवीण सर, ओवर टू यू, थैंक यू।